If anyone is new to these sessions, just a little bit of background on IPRO. We are the quality improvement network for these 11 states and the District of Columbia. And we're also the hospital quality improvement contractor for these states as well. Today, we are going to be talking about Category 6 of the Health Equity Organizational Assessment, and this is addressing and resolving gaps in care. Next week, we are going to cover Category 7, and we actually have 2 guest speakers from 2 different hospitals joining us, so that should be a great session as well. And again, if you're new to the session, just a quick overview of what this is all about. The purpose of this series is to help your organization to identify opportunities for improvement in its ability to collect, validate, stratify, and analyze patient demographic data to better identify and address health disparities. So we sent out a health equity organizational assessment, which many organizations completed, and then we returned a report to all those organizations to identify areas for opportunity for improvement. So today's category, again, addressing and resolving gaps in care, is really the apex, I feel like. If I had my druthers, this would be the last one. And the one that we're doing next week, organizational infrastructure and culture, actually would go at the top. But everything that we have covered so far really leads to this point. So this is, it laid the groundwork so that we can now finally do the important work of addressing the identified disparities. So we're going to do a quick poll question. I'm just interested to know, has your organization taken action or is in the process of taking action to implement an improvement for any of the 7 HEOA categories? You can select as many as you'd like, but we have the 7 categories listed there. If you don't know, that's fine too. You can select that or none of the above. So we're just going to wait a few minutes, let people reply. So it looks like we have 38% have done some improvement in data collection, which is the first category, some in data collection training. Oh, and we have some who are doing improvements in this particular category, which is addressing and resolving gaps in care, and then about 50% don't know. So we still are getting some responses. Sorry, I jumped the gun. We have another one here doing some improvement in organizational infrastructure and culture. Okay. Great, thank you so much for sharing that. Ryan, I'm sorry, Ryan, did we post the results? I forgot to say that. Sorry about that. I need more caffeine. Okay, so here are the results. So we see quite a few are doing some improvement in data collection, and in this category, really all of them, almost all of them except communicate findings. So that's great news. Obviously, we're happy that this has been a helpful exercise for all of you. So the purpose or the best practices for addressing and resolving gaps in care are that you may remember a few weeks ago we talked about data stratification. So you use the data stratification and analysis to help identify those gaps in care. And basically, you're targeting specific populations that are experiencing those disparities. And then once a disparity is identified, our recommendation is that you create SMART goals and an action plan. So I'm going to jump ahead here to talk about those. So a SMART goal, when you're thinking about developing a SMART goal, you want to consider the following guidelines. So for the S that you see listed there, specific, you want to define the goal in the terms of the 3 W questions. What do we want to accomplish? Who will be involved? And where will it take place? So you may want to do it in one provider office or one clinical setting. On a smaller scale, you're defining where this is going to take place. For M is measurable. You want to think about how you're going to measure or evaluate if the goal has been reached. For A, attainable, you're basically defending the rationale for the evaluation measures you defined in the previous step. How are you going to evaluate your success? And so that's basically what we're doing, is defending the rationale and making sure that you can actually, that it's reasonable and it's attainable. For relevant, you want to describe how the goal will address the disparity that you identified in step number 1. And then for time bound, you want to set a target date for achieving that goal. So that's what we mean by SMART goals. And then we talk about developing an action plan. So here is an example of an action plan from a disparities impact statement, and this is from the CMS Office of Minority Health. This is a fillable worksheet that has 5 steps to guide you through the process of identifying and addressing disparities. And we have the link to this document in the bottom of the slide here. So this is an example of one action plan. There are many out there. Here's an example of another. This one is listed as an aim rather than as a goal. They're both the same. So you want to put your aim or your goal here in the first column. And then you have your primary drivers, your secondary drivers that are going to help you achieve your aim or your goal. The individuals or organizations who are going to be helping you to achieve your goal, who are responsible for certain tasks to make sure that happens. Again, very important, your metrics and your measurable outcomes. How are you going to measure success to make sure you're achieving your goals? So these are just 2 examples of action plans. There are many out there. So I'm going to hop back here and go back to this slide. So after you have identified your SMART goals and your action plan, and you want to start implementing your intervention that you have identified that's going to help address that disparity, the recommendation, the best practice, is to use a PDSA methodology, which you may know is Plan, Do, Study, Act. I'm going to jump ahead again. And so this is from the IHI. It says their model for improvement. And basically, this allows you to do a test of change in a real work setting, but on a much smaller scale. So it's much easier to implement an intervention on a smaller scale first. And the cycle guides the test of change to determine if the change is an improvement, is it going to work? And through several cycles of refining it, when you finally get it to the point where it's successful, then you can implement the change on a broader scale. You can spread it. So the recommendation is, again, to implement your intervention using this PDSA cycle. Okay, I'm going to go back. This is to keep you awake. I'm going through all the slides back and forth. So the next recommendation is that you regularly communicate the goals of your intervention throughout your organization. And this basically is to get buy-in from everyone, to maintain momentum, and to make sure that everyone stays focused. You want to keep frontline staff informed and working toward the same goal. They are critical. They're going to be critical to your intervention success, so it's really important to keep them in the loop. And then, as I mentioned when we were talking about the PDSA, is once your pilot is successful, you've refined it, you want to create a plan to spread it throughout your organization. You may spread it to another department, you may spread it system-wide, although that doesn't typically happen. You spread it in a refined fashion until you have it out there to make sure that you're addressing those disparities. Okay, so now I'm going to move forward here. So I have here an example of a completed action plan, and I'm not going to go through all the details, but I wanted to include it. There's actually 2 pages. I am including 2 pages. It was actually multiple pages, but I'm including 2 pages of the action plan here, just so you can see an example of one. And this is a fictitious action plan for a hospital that you can see they set a SMART aim. It's very specific. Again, we want those aims or goals to be specific. So what it's saying here is that our hospital will close the gap on avoidable readmissions for females 65 years of age and older who have had a heart attack. So there is less than 1% difference in rates between Black females and their white counterparts within 12 months. So you can see it's specific. They set a time frame. It's measurable. So this is a really good example of a good goal. And then here's one of the primary drivers that's going to help them to implement their goal. They're going to refer the patients to cardiac rehab, which is an evidence-based program that we know helps folks after they've had a heart attack and basically avoids readmission. So they're going to do cardiac rehab referrals for Black females. And then you can see here all the secondary drivers that they're implementing to basically achieve their primary driver. And then we list all of the key individuals and organizations that are going to help make this happen. So one example of a secondary driver here is you see that they're going to work with their IT department to put a trigger in their EHR to make sure that when there's a patient that meets the criteria, that it triggers the staff to do the referral. So that's one example of a secondary driver. Let's see, is this the one? Let me go to the second page. I like this one because it addresses a social determinant of health. So we still have the same goal here. And then this is another primary driver. With the evidence has shown that cardiac rehab is most successful for patients when they do a minimum of 36 sessions. For some patients, that's can be a heavy lift, you know, getting to a program 36 times. And one of the things that was identified in this fictitious scenario is that some of the patients have issues with transportation. So the hospital decides that they're going to screen the patients using for social risk factors. And they are already anticipating that transportation is going to be an issue for some of the patients. So the hospital is actually going to implement a transportation program that's going to provide free transportation to and from the cardiac rehab for the target population. So that's an example of addressing a social determinants of health in this scenario. And they're going to implement a reward program to motivate patients to complete the program. So these are just different secondary drivers that they have decided to try to implement to meet their primary driver. So the last step in this whole process of this particular category of addressing and resolving gaps in care is a really important one. And that's that reviewing, monitoring, and recalibrating. So as we mentioned on your action plan, you want to define metrics and measures to monitor and track progress toward achieving your goals. Obviously, if you implement an intervention and you're not tracking it, you're not going to know if it's successful or not. You want to define how often the monitoring will take place. You want to define who's going to be responsible for doing that monitoring and ensuring that there's a continuous feedback loop throughout the organization. And really important, you want to report progress to leadership on a regular basis. So this will ensure their support and allocation of resources, i.e. funding, for future equity interventions. And even if things aren't going exactly as planned, it's still important to communicate to leadership what's going on and how you're going to mitigate those issues. So this is a really important step to review, monitor, and recalibrate. So think back to that fictitious action plan that we just looked at. And so let's just say that hospital has started to implement that intervention. They're doing referrals for cardiac rehab to close that gap in avoidable readmissions between Black and white females. And at the 3-month point, they are assessing their progress. And what they're finding is that they're not meeting their goal. So you can see here in Q1, the hospital only reduced the gap to 8%. So they're not on pace to meet their 12-month target. So the quality improvement group that's implementing this decides to do a PDSA. And they do some tweaking to the intervention. They figured out that the triggering mechanism wasn't working correctly in the EHR, so they worked with IT to fix that. And they did some other things to tweak the intervention. And in Q2, we see here that the test of change did elevate performance. So they reduced the gap to 5.5%. However, based on this graph, something else not so good is happening. Can anyone see what is happening in Q2 that's not so good? Feel free to come off mute if you can see what's happening here.
Laura, we have a response in the chat. Debbie Campbell said everyone got worse.
I'm sorry?
Debbie Campbell in chat said everyone got worse in response to your question.
Thank you. Yes. So the good news is reduce the gap. The bad news is you can see readmissions actually increase for both groups. So good catch. So a good news, bad news scenario, but that's the whole point of doing measuring. So they continue to implement and refine their intervention. And we can see here in Q3, they've reduced the gap to 3%. And then within their 12-month period, yay, they reached their goal. This is my scenario. I get to say it's been successful. But that's the point is, you get the point, is you have to measure throughout the process to make sure that you meet your goal. And by continuing to monitor, you can refine the intervention until you achieve that goal. And after a year, the hospital has achieved it. They're at 0.8% in the gap between Black and white females. So this is again through using PDSA, continuing to refine that intervention. So if you, these are the elements or best practices for addressing and resolving gaps in care, and these are recognized by national research as critical components for identifying and addressing disparities. So again, if your organization completed an HOA, you received a report outlining your assessment. And this is a screenshot from the report, so it may look familiar. But, and obviously here, the levels of implementation we explain those in the overview webinar for this session, which the recording is on the website. I'm happy to go listen to that recording. But there are only 3 for this particular category, but they're 3 very important ones. So you want to develop and palette test interventions. And then, you know, continuously informing and involving staff and workforce and supporting the process, and have a process in place for ongoing review, monitoring, and recalibrating. So these are the 3 best practices for this particular category. And our one of our resources, our best practice strategies for organizational health equity. This resource is in our resource library. And so this is the screenshot for this particular category, addressing and resolving gaps in care. And you can see here, we have the best practices listed here. And then we have actual more detail, more tasks that help you to implement those best practices. And then we also have some resources here. And here is the CMS Disparities Impact Statement that I referenced earlier. We have the link to the IHI PDSA worksheet and some other worksheets and resources that you may find helpful to implementing these tasks. And this particular resource, as we've mentioned in previous sessions, covers all 7 categories. So you'll find best practices, tasks, and resources for all 7 categories. So I'm going to stop and see if we have any questions or comments in the chat.
Laura, no questions, but Debbie Campbell just appreciated, you know, using the model for improvement as a way of highlighting how to do this work.
Thank you. So it'd be really helpful if everyone on the call, or some of you on the call, would be willing to come off mute or in the chat, share with everyone else an example of an intervention that your organization has implemented to address a disparity. Doesn't have to be a lot of detail. If you could just give a sentence or 2 about what that intervention is and what disparity you were addressing. And again, we welcome you to come off mute if you'd like to talk to the group.
Laura, while folks are getting geared up, I can share an example that I read in a case study a couple of weeks ago, and this was at the University of California, San Diego Health. So there was someone there who realized that when they were collecting their data, when they looked in their EHR, they about 30% of their patients indicated that they were, only like a very small percentage of patients indicated that they were Hispanic or Latino, despite their local census data indicating otherwise, that it's likely be higher. So what they did was they initially developed a governance committee, involved all their staff, everyone from registration, quality operations. They added appropriate categories in their data, which was race, ethnicity, and language data. And then what they ended up doing was they found that there were differences in tobacco cessation between certain race categories, and they focused a quality improvement project on that particular intervention. And they were able to improve their workflow and also increase rates for other races. So it's interesting that, by collecting that information, they were able to then kind of focus the quality improvement project. They ran a PDSA cycle and just made sure that the things that they were improving were making a change and ended up improving smoking cessation across the population.
Thanks, Pooja. That's a perfect example. If they weren't collecting that demographic data, they would have no idea. So that's the whole point, again, of all of these categories leading up to this particular category today that we're talking about, where we can address the disparities. So thank you for that.
Right, and the other thing I was going to is having a little check to make sure that the population that your community is serving kind of is reflected potentially in the data. So if you're seeing something that looks a little odd, digging in deeper and trying to address that issue.
Yeah, so I'm having a blank. One of the categories is validating data is to make sure that the data that you're collecting is in fact in alignment with what your community data are. So that's a perfect thing that you highlighted. And that's part of data validation, is to make sure that it's consistent and that your data is not off. And it seemed like with that particular facility, they were seeing some differences between what they were collecting and what was happening in their community. So that's a great example of that. Thank you. Anyone else care to share?
Don't see anyone in the chat responding. I guess just to say, Laura, the example you shared can be replicated across different, areas within an organization. And it's nice to kind of start small and develop that quality improvement team that has different disciplines, so that, you're seeing the perspective of different members of your organization, and then trying to leverage that same expertise when you have additional quality improvement projects.
Yeah, I think it makes it less intimidating when you think about using PDSA and implementing the intervention on a much smaller scale. You do not have to do it organization-wide, of course, starting in one clinic, starting in one provider practice, and then refining it through several cycles. We work with an organization that changed their patient information sheet, the information that patients fill out when their registration sheet, when they're a new patient. And they went through several cycles of, should we do it in written format? Should we give them iPads? Should we do it, one-on-one with the patients? And they went through several different cycles. They actually interviewed patients, and they refined it down to, they basically decided to do written and to do the iPads, which is what they determined would work best. And they did that in one clinic before they expanded it. And that way, obviously, as you're going through the cycles of improvement, you're having less impact. If you had implemented that system-wide, it would be a lot harder to manage. So that's a good point.
Right, and I was just going to say, and you beat me to it, that making sure that you're able to collect patient feedback as well as, other staff members' feedback as you're doing the PDSA cycle, because, that can really make the difference in terms of, making a tweak and understanding where some of the, different perspectives lie. We have one comment in chat from Debbie. Thanks, Debbie, for volunteering. She was just saying that, everyone is getting started with this work. So they may not have, examples of interventions currently.
Good point. Good point. No pressure. I just wanted to open up if anyone wanted to share. But so I think we sent these slides out ahead of today's presentation. You can also access them on our website. After a few days, we'll be posting them. And I hope that you find the information that was included here helpful. Lots of times when you're looking at a blank action plan, it can be a little intimidating. So to see one filled out, I hope that is helpful. So I'm going to move forward so we make sure we get everyone out of here on time. So leaving an action, we have some tips for success or small steps of change. After, again, that you identify a disparity based on that data stratification and analysis that you've done, you want to develop your SMART goals, create an action plan, implement your intervention on a small scale using PDSA, review, monitor, recalibrate, and then after that refinement process is successful, develop a plan for spread. So next week is the last category, organizational infrastructure and culture. And we're very pleased that we're going to have two guest speakers, Athena Miner and Charles Redd from Ohio County Healthcare and Fairview Hospitals. So we hope you can join us next week for this important topic. It will be the last of the 7 categories, and then we're going to have a wrap-up session on August the 4th. Again, here is information on our resources. This one that's highlighted is the one that I showed you a few slides ago. So that's the name of that one. And then you can see we have several other resources here that you can access through this single link in our resource library. If you're interested in accessing the recordings of previous sessions or the slides, or if you'd like to register for the 2 upcoming sessions, you can use this link and you can find all the information on the HOA sessions at that link. If you have any questions about implementing any of the improvements that you'd like to relative to the HOA, or of course anything else in quality improvement, please reach out to your HQIC or QIN-QIO advisor. If you're not sure who that is, you're welcome to contact Stacy or myself and we will put you in touch with the appropriate person. You can learn more about IPRO and stay connected with us, of course, in social media. But if you go to our website and go to About Us and do the drop down, we have the HQIC and the QIN-QIO sections of the website. Our health equity newsletters are out there. And again, all previous webinars, not just the HOA, but all of the webinars that we're doing with the facilities that we work with. We hope that you will look at our website and see what work we're doing. I believe that Ryan sent out the link to our survey. It would be really great if you could complete the survey and let us know how we're doing. If you like the session, we're thinking about next steps when this ends. We seem to have a core group here that keeps attending. We'd love to keep that momentum going. So we're thinking of maybe an affinity group and actually having a health equity intervention that we can all try to implement together. If that's something that's of interest, we'd love if you would complete the survey and in the comments section, let us know. And we'll also discuss this more on the last session on August the 4th. And again, thank you so much for your continued partnership and your commitment to health equity. It's so great that you attended today. Thank you so much. And we will see you next week.